welcome. You're watching the Health Talk session by Yashoda Hospitals. Despite advances in prevention and optical medical therapy, coronary artery disease remains one of the leading causes for mortality and morbidity in India. Traditionally, bypass surgery and angioplasty are two methodologies used to treat coronary artery disease. Ironically, there is a group of population which are turned down for these procedures because they are considered too high risk. And these are the patients who require a special skill set by interventional cardiologists to treat them. So what is CHIP Angioplasty and how does this procedure benefit these high-risk patients? So let's discuss about CHIP Angioplasty and more in our today's episode. I'm Dr. Lakshmi and let's welcome Dr. C. Raghu, Clinical Director and Interventional Cardiologist from Yashoda Hospitals, Secunderabad. Welcome to the program, Doctor.
Hello, Dr. Lakshmi here.
So doctor, a growing number of patients with coronary artery disease find themselves in need of angioplasty or bypass surgery, but they are told that they are too high risk to get these procedures done. So how do we address this growing population of patients?
People who are affected by blockages in the heart vessels are nowadays getting more and more complicated. This is due to the increasing prevalence of diabetes and high blood pressure, leading to earlier onset of worsening kidney function, increased longevity of the people, and also people having had a heart attack and surviving after the heart attack, leading to a reduced heart pumping ability. So, people who have got kidney dysfunction, people who have got low EF or heart pumping dysfunction, or people who are elderly are getting more and more heart attacks or blocks in the heart vessels. So, this group of patients are increasingly prevalent in the society, and unfortunately they are not being addressed properly because the therapeutic options are complex and fraught with challenges to the clinician who is treating the patient.
So which group of patients are considered to be high risk to consider for traditional angioplasty or bypass surgery, doctor?
High risk patients, Dr. Lakshmi, are a group of people who tend to be affected with high creatinine. The creatinine might not be very high, they might be in the range of 2 or 1.9 to 2.8 or 3. So, those group of patients are those with mild kidney dysfunction, and the second group of patients with the kidney dysfunction are those who are in the 6th and 7th range who might be on dialysis already, or the other group of patients who tend to develop more cardiac problems. So, that is the first group. The second group of patients, as we have discussed previously, would be those who have had a heart attack, who had a low ejection fraction, they had a significantly large heart attack and reduced heart pumping ability, and these people tend to have multi-vessel disease, that is blocks in all the 3 vessels at multiple locations. The third group of patients are the survival of Indian population, especially in certain economic subsets, is increasing. So, it is not uncommon to see people who are between 80 to 85 years of age having multi-vessel disease or a blocks in critical locations of the heart. These patients tend to suffer from lot of chest pain, they tend to have worsening of kidney function, and they tend to have worsening of heart pumping ability. So, they are terribly incapacitated by the development of the heart blocks, which require treatment, but unfortunately because of the complexity of the scenario at many centers, these patients have been turned down. This turn down is not only just for angioplasty, but they remain to be high risk for bypass surgery also. So, that makes them this group of patients who deserve the angioplasty, but who have been denied angioplasty. So, in the West or in the medical literature, Dr. Lakshmi, we have been calling them as the complex, high risk, indicated patient. That is, these patients are complex, they are high risk, and these patients are indicated. That means, if we perform the procedure, they are going to get benefited. So, this is what is the CHIP angioplasty or the complex high risk indicated patient or procedure angioplasty. So, these are the groups of patients whom we need to offer solutions, and those solutions need to be durable, successful, and we need to be predictable also. That is what we tend to address nowadays.
So these are the patients who are denied but they deserve. That's when CHIP angioplasty comes in. So could you elaborate more on this technique, doctor?
For anything in life, we need to prepare well. It could be an examination, it could be an interview, it could be for life. We need to prepare well. Similarly, for a CHIP angioplasty, preparation of the patient for the procedure is an important step. So, many a time we prepare the patient sometimes for a few weeks or at times for a couple of months to get all right or they get ready for the procedure. That is what is the preparation for the procedure. Then the second thing that is very key is the pre-procedure planning. So, most of these patients have got complex lesions. So, when they have complex lesions, we need to use different types of technologies. We might have to use different type of techniques to improve the result or to get the best result. So, pre-procedure planning and preparation of the patient are the two key steps for the procedure.
So what are some of the challenges or limitations associated with this CHIP angioplasty procedure, doctor, and how do you address them in your clinical practice?
The challenges remain predominantly what I see in the society are the lack of technical expertise to perform the procedure and the availability of technological advances within the cath lab to overcome these obstacles. The challenges, for example, let us say person has got a low kidney function. It is not uncommon. So, what do we do? So, we need to adopt a strict preparation like what I was discussing and planning, and while performing the procedure we need to do certain special techniques to limit the contrast. So, we try to achieve the best result within 10% of what we normally use. So, that will reduce the damage to the kidney. The second thing what we do is we adopt certain special techniques like focused angiography into the vessel by using certain microcatheters and using some collateral angiography to limit the contrast. At times, if the patient's kidney function is at very high risk, we tend to do a zero contrast angioplasty also. So, that means we use only the intravascular ultrasound to overcome the contrast load. Then the second challenge what we see is patients who have got a reduced heart pumping ability. So, for people with reduced heart pumping ability, here technology plays a lot of role. So, we tend to take the patient on a cardiopulmonary support equipment like the Impella, percutaneous cardiopulmonary support or an intra-aortic balloon pump or a IABP to support the heart during this high risk angioplasty, and this has been shown to improve the outcomes of angioplasty, and most importantly we can perform a safe angioplasty in such a complex high risk scenario. Then finally, when we take elderly patients, they tend to have lot of calcified blocks. So much of calcium in the artery. So, what we do is we reduce or debulk, or that means we remove the calcium from the artery by using technologies such as rotational atherectomy or rotablation, or we use orbital atherectomy. Similarly, for people who have got a total occlusion or people who have got a large amount of thrombus burden or people who have got a lot of calcium, we can use a laser also to soften the clot or dissolve the clot or sometimes soften the calcium, and so that to enable a safer angioplasty. So, all these adjunctive technologies and collaborated with the technical expertise of the operator can allow the patient to get the best possible outcome in this group of patients.
So in general, patients experience dramatic improvement in symptoms, improved quality life, and less readmissions to the hospital, doctor?
Yes. So what is the benefit what the patients experience? First is relief of angina, which is dramatic in these patients. Improvement of the left ventricular ejection fraction. So here we combine angioplasty with good drugs or sometimes pacing modalities to improve the cardiac function of the patient. The third thing is, it is not uncommon to see people who have got heart blocks tend to have a worsening of the kidney function. If the heart does not work well, the kidney worsens rapidly. So unless and until we repair the heart, the kidney does not get better. So the kidney also gets better, and obviously when you have the heart, the kidney, and there is a relief of angina, obviously that will translate into much reduced hospital admissions, and thus causing a improved longevity of the patient.
So what is the success rate of this procedure in general, doctor?
For a complex angioplasty in the hands of a technical expert, the success rate should be in the tune of 95 to 98%, and the risk should be less than 2%. So this is what we endeavor in all these CHIP procedures. These results cannot be replicated in a center which is low volume and where the operator experience is less than optimal.
Undoubtedly, with the development of CHIP angioplasty and CHIP centers, interventional cardiology has gone miles ahead in safety and efficacy. So before ending this episode, doctor, what message you would like to give to our audience out there as far as CHIP angioplasty is concerned?
People who are suffering from multiple other ailments like low heart pumping, low kidney function, elderly age, post bypass, complex lesions like bifurcation, left main, calcified lesions, large thrombus burden. So those groups of patients should look for centers which can perform these angioplasties with a very high success rate. The availability of a proper technical expertise and availability of the technological latest advances to perform the procedure are key for a successful outcome. Once the procedure is successful, these people tend to have a very good life without repeat hospitalization. Quality of life would be better, the survival rates will be better, and their hospitalization rates will be low, their kidney function will improve, and heart function also should improve. So these are all the advantages what we can expect from this CHIP angioplasty, and this procedure is best performed at large centers like Yashoda Hospitals, Secunderabad, where we have the availability of an ECMO, availability of a percutaneous cardiopulmonary support, we have availability of Impella, intra-aortic balloon pump. Similarly, new technologies like the orbital atherectomy, laser, which are available, will allow us to perform a successful procedure with least risk to the patient. I am sure people who listen to this episode will understand more about these complex angioplasties and know that they have solutions that can be offered which can result in a dramatically improved quality of their life.
So thank you, doctor. It was wonderful having you here on the program today.
Thank you very much.
So this brings us to the end of this episode. Hope this episode was informative on the topic CHIP angioplasty, and don't forget to join us for the next week as well. Until then, take care and stay healthy. Thank you.